Okay, go for it.
Okay, so this one might be a little longer than an hour, so I'm going to try not to ramble and just get through it. We're going to talk about medications and medical. Try to hold your questions till the end. You can type them in the chat box if you don't want to forget, but we'll have like an open Q&A at the very end. All right, here we go. So today we'll talk about the first quiz, which was about sanitation and food and some of the commonly missed questions, common terms and abbreviations, information sheets that we have hanging up around the nursery that are important, types of medications, routes of applications, and then I have some how-to videos, pilling, oral medications, injections, subcutaneous fluids, temperatures. I also have included shelter love tutorials. Some of you already know how to do this, but I do have shelter love tutorials in the drive. Everyone has access to them. So I'm just going to show you a couple of them that are extremely important considering like medical and medications, just so everyone is aware and has the same protocol. We'll do a Q&A at the end. There's some commonly asked questions in Sling that I've already put in there that I'll talk about, but otherwise we'll open it up for discussion at the very end. All right, so from the first quiz, everyone did really well. I know the quizzes kind of stink because with the forms, it like only takes a very specific answer. So some of them were marked wrong, but you guys weren't actually wrong. So I went through and actually read all the answers, and some of the most commonly missed things. Top two are very important. Kennel handles are contaminated. You want to touch kennel handles with gloves. The reason for that being, it's basically impossible to be working in a kennel and close that kennel door while taking your glove off, because you're probably holding a bowl. You might be wrangling kittens back inside. You can't wrangle a kitten and take a glove off at the same time. So it's safe to assume kennel handles are always going to be contaminated. Always touch them with gloves. Sometimes you have to touch them with a clean hand just because of what's going on. You may have a kitten escaping something, whatever. Just make sure that you wash your hands afterwards. Kennel handles should also be wiped down at the end of every shift with rescue. I think everyone got that right, so no problems there. This one is also confusing. Trash lids and laundry lids are clean. The reason for that, I sent it out in an email explaining kind of different situations why this is important. But if you are touching the trash lid with dirty hands, and then you go and you wash your hands, and then you go to throw away your paper towel, you touch that lid again with your clean hands, and now they're dirty again. That's just like one example of why it's important. So we should always assume trash and laundry lids are clean. It's only the stuff inside that is dirty. So one of the best practices is when you get in and you start your shift, just take off that laundry lid, take off the trash lids, and then you don't have to worry about it or touch it later. When you do a buffet, 3 steps after finding out which food a kennel likes, you'll want to hang up a kennel card. I see that one gets skipped sometimes, but it's like the one that's just in your face. You see it right there. It says Royal Canin and Fortiflora right on their kennel. So even if the volunteer doesn't know because they didn't see the shift update, they can still see it exactly on their kennel. So that one's super important. You also want to write on special food instructions, so we have it in multiple places in case the card falls down or things change. And then obviously post on Sling just so everyone kind of has an idea. Another commonly missed question was every kennel does get dry food. We do need to give every single kennel dry food, even if they're too young and they're not eating it, even if they don't like it, because legally we have to give food, have unlimited access to food at all times. So it's always a good idea to give them dry food. If you notice they're not eating it, you can fill their bowl up just halfway. You don't have to fill it to the brim, but we do always have to make sure every kennel gets dry food. The only exceptions to that are going to be if they have a very special diet. So like Kenley, he's only on the Royal Kitten GI. We don't want to give him other dry food because it's going to mess up the stomach. Another thing, a lot of people said you have to wear gloves when doing the dishes. I guess this can kind of be considered a trick question because when you put the dishes in the bin, you have to be wearing gloves. But once you're actually washing them, if you've let them sit for 10 minutes, in theory, the virus and bacteria should be gone. So you can wash them without gloves. You might want to use gloves if you're trying to protect your hands from bleach and keep being dry, but you don't have to actually wear gloves while you're washing the dishes. Another trick question, the OB kennels. They were originally called the OB kennels because they were going to be for the nursing moms, but now it is our pan-luke ward. Only shift leads should really be allowed in there, especially while we have active pan-luke. just because it is obviously, as we know, deadly, and we want to make sure we used very careful protocols when we're in there. So that's just a recap from commonly missed questions. We can, if anyone has any questions on that, we can always talk about it at the end too. All right, common medical terms and abbreviations. You will see a lot of this stuff is on Shelter Love, but you will see SID, which is once daily. In Shelter Love, it'll also have AM or PM. So if you put just SID in there, it's going to automatically do AM, but if you do SID PM, it'll be for PM shift. BID twice a day, QID 4 times a day, and TID is 3 times a day, so there's all of that. EOD every other day, Q3D every 3 days. You could do this for anything. You could do Q7D, you could do Q14D, so that would be every 7 days, every 14 days, whatever it may be. That's kind of how it's abbreviated. Other things we'll see is BAR, QAR. BAR means bright and responsive. That's what we want all of our kittens to be. QAR is quiet and responsive. Quiet and responsive can be because they're actually sick, or it can be because they're hissy and hiding in the corner. So that can mean either. So you can't just really say QAR. Ideally, give a little bit more information about what's going on. PO means orally, by mouth. SQ is subcutaneously. There are so many terms and abbreviations, but these are just ones you'll probably see in Shelter Love fairly frequently or on your task list. Important information sheets. So we have a ton of important information sheets hanging in the nursery. I actually just redid these two, and Brenda actually helped me. So I'm going to be printing them out and hanging them up. We have the medication cheat sheet. So we get a lot of questions about what's Drontal, where's Drontal? It's actually worm out. So Drontal, we put alternative generic names, just worm out. And the active ingredient is actually praziquantel and pyrantel. So this is, sometimes you'll hear us say pyrantel or strongid. This is just to kind of give you an idea of all the different names for the same thing. I also decided to put the Revolution dosage and Drontal dosages on here. Just because I don't think we have it, I have it listed in Shelter Love, like when you actually are required to do the task, it says it in the information. But here's another way, we'll put it right by the intake table so you can see it right in front of you at the time you actually are like cutting the pill or pulling up the Revolution. So that is all that. We can always add stuff. These are the most common things we use. If you guys think of anything you want me to add to here, you can just type it in the chat or let me know at the end and I will add it. Medication dosages. So I actually just changed this today. I updated it to the Metronidazole 100 mg per mil because that's the one we generally have. So you're going to see these dosages are pretty small compared to the one we had previously, which it said the Metronidazole 50 mg per mil dosage. I also added the actual mgs per mil on some of the other ones that weren't listed. For example, Panazerol 100 mg per mil. It's actually 0.2 per pound. Be careful because we have 2 bottles of the 100 mg per milliliter, which is going to be 0.2 per pound, but we just got in a 200 mg per milliliter. So you're going to cut that in half and it'll be 0.1 per pound, which is what we used to be doing. I highlighted it on the bottle. I marked it in bright orange. So just always pay attention to what mg per milliliter the concentration is before you dose out medication. Sometimes it is different. Same with the doxycycline. Right here, it's the 100 mg per milliliter. Occasionally we get the 50 mgs, which means you would double it. So these are all the medications. I know it's in ounces, but you can either look at the actual dosage on this chart, or if you know their pounds, you can do, say they're 5 pounds, you would do for doxycycline, you do 0.05 times 5 pounds. That's how much they would get 1 time a day, 7 to 10 days. If you have any questions about this, let me know. If anything looks off, let me know, because I just did this literally right before I started this presentation. But yeah, Beagle score chart. I'm gonna hang this up in the nursery so everyone gets to see this every day, this beautiful piece of artwork. It is important, and I think we should start using it a little bit more to explain. If you don't send a picture, if you send a picture, then we know. But if you didn't get a chance to take a picture, or if a volunteer goes and tells you, oh, there was diarrhea in the kennel, you can be like, can you show me on the chart what kind of diarrhea? Because it does, depending on the type of poop, does depend on the type of medication we use. And I'll just leave it at that. But I'll put this up on the nursery. Dr. Tran actually wants it up there too, because especially like fosters, volunteers, sometimes it's hard to explain exactly what a poop looked like if you didn't get a picture, so this will help. Feeding kitten protocol, I am not going to go super into detail with this because I hope most of you know. I know a lot of you have actually been to the critical care class, but basically, unfortunately, as shift leads, we do run into this every once in a while. As you know, you'll basically find a limp / lethargic / unconscious kitten, and you'll want to start feeding kitten protocol, which is warming them up, getting sugar in them, Caro syrup, and contacting us to get them into a vet. This is hanging on the refrigerator, I believe, for all of this in case you ever want to review it. We do have it in the drive also, if you want more information and to actually read this whole thing through. But that's the basis of it, and it is super important that we all know how to do this, because in an emergency, you do kind of panic and you do like, oh my gosh, what do I need to do? But at least if you know this beforehand, you're like, okay, let me get my let me get my heating pad, let's get some Caro syrup, let's call Jessica and Claudia or Renee if you can't get a hold of them, and then, you know, we'll take it from there. All right, what are these meds? So I'm not going to go super into detail about this. You guys can research this on your own if you would like to. But the type of protocols we follow are shelter medicine. Shelter medicine is a field of veterinary medicine dedicated to the care of homeless animals in shelters and other facilities dedicated to finding them new homes. Shelter medicine is different from private practice medicine. Private practice veterinarians, so that's probably where you take your personal animals. So that would be, you know, Primary Care Animal Hospital, Pine Animal Hospital, whatever. I'm just listing off a few, but those are private veterinarians. The medicine and protocols we use are more based off of shelter medicine. We do blend it sometimes. I mean, obviously, when we have a cat like Kenley, you can't use shelter medicine. He needs to go to the vet and get diagnostic testing and, you know, figure out what's really going on. But in general, for the majority of the population, we do follow shelter medicine. Shelter veterinarians provide a unique blend of individual and population level care for homeless animals. Most of the animals who arrive in shelters, which we're not a shelter, we're not open admissions, but we are a shelter setting. We do have a lot of animals put into one room. We are very different from the shelter also in the fact that we have much stricter protocols than a lot of shelters and even a lot of other rescues who have like catteries, I guess I'll call them. So luckily, because we have such strict sanitation protocols, we don't run into as many problems as a lot of shelters do, but we do follow a lot of their veterinary medicine. So shelter animals arrive with little to no medical history. They may be strays, ferals, or victims of cruelty, which we have seen all of those in our nursery. They come from different locations, different experiences, histories, potentially in contact with infectious disease and problem behaviors. It also gets worse in a shelter setting because it's high density housing and it is stressful to be in a kennel for a very long time. So we do run into a lot of things being in a shelter setting. Shelter medicine was formally recognized by the American Veterinary Medical Association as a veterinary specialty in 2014. An acknowledgement that veterinarians who work with or for shelters require special knowledge and skills to design a successful shelter healthcare program. The reason I'm mentioning this is because a lot of you have been with us for a long time, so you know we don't take our kittens to the vet for every single case of diarrhea, which, you know, your cat at home you might do. Instead, we do things a little differently. Some examples are, you know, we preventatively deworm. We don't run a fecal on every single one of our kittens. Instead, we preventatively deworm, even if they aren't showing symptoms. So all of our kittens get drawn to whether or not they have diarrhea, just in case. Especially because, you know, in a setting like that, there is a chance stuff can spread. So you'd rather be safe than sorry. Other differences between shelter medicine and us, big ones, are we do vaccinate a little earlier than a private practice would. And that's because the risk of, as we know, panleukopenia is higher than a vaccine reaction. So we generally vaccinate at least a pound. We try for 5 weeks, but if we're super populated, we'll go as low as 4 weeks as long as they're over a pound. Whereas in a private practice, they're not going to want to vaccinate your kitten until they're lowest 6 weeks, but generally they want to wait till they're like 7, 8 weeks old for that first vaccine. So that's one big difference with shelter medicine. And then another big one is that, and you probably have noticed this, we get cats spayed and neutered at 2.5 pounds, sometimes 3, but private practice wants them to be at least 6 months old, which isn't realistic in a rescue setting when you're trying to get kittens out, and nobody wants to wait for a 6-month-old kitten realistically. So a lot of high volume, other shelter medicine like SNP LA, Golden State Humane, all of these places we use to get our cats spayed and neutered will do, you know, the lower weights because it is shelter medicine and it is approved. So there's a lot that goes into shelter medicine. I just wanted to bring it to everyone's attention that it is a thing, and a lot of our protocols are derived from this. Maddie's Fund, Austin Pets Alive, a lot of the big name rescues and shelters, we actually follow a lot of their protocols. All right, so this is just, you know, for your knowledge. We have a lot of antibiotics in the nursery. Some common ones are amoxidrop, which is amoxicillin. We use that for upper respiratory infection, usually in younger kittens. Azithromycin is for a severe URI or resistant URI. It's much stronger. Clavomox, we see Clavomox a ton at the nursery. It's for a URI, but it's more so for flesh wounds. So like when Dave got his toe amputated, we had him on Clavomox because he had an open wound. Starla with her mammary glands and stuff like that. So we see Clavomox a lot. We use Clavomox a lot. So that one does need to be refrigerated, but generally used for wounds. Can be used for URI also. Doxycycline, that's a big one we use for an upper respiratory infection. It's kind of our first go-to before other things. Dewormers, antiparasitics. So you see we use Drontal a lot, which is the worm out. That takes care of tapeworms, roundworms, hookworms. Metronidazole is for Giardia, but also an antibiotic. So it treats secondary infections. It's kind of like our last resort when dealing with diarrhea. We always try the, you know, worms and parasites first. Since metronidazole is an antibiotic, you also want to pair it with probiotics. And so we do use that one a lot, but it's generally once we can't figure out the cause of the diarrhea. Usually a secondary infection or a weird Clostridium or something is involved. Panicure, which is the Safeguard with the goat on it, is used for Giardia. It's also a general dewormer, can take care of roundworm and hookworms, but we generally use it for Giardia. Benaziril is very specific for coccidia. Coccidia is life-threatening in cats. The younger, the more life-threatening it is, but it usually has yellow, stinky poop, but not always. Recently, we've actually had a few coccidia incidences where it didn't really look like coccidia, but was. So we usually use that one too. Pyrantel is for roundworm hookworm, usually for younger kittens, because if they're older, we use the Drontal. And then triwormer is if you can't get the Drontal pill down their throat, and it takes care of the same stuff. So all of those are dewormers and antiparasitics. You'll see them a ton because we do a lot of them preventatively, and the cats who come from the street usually do have parasites. That's just kind of how it goes. Supplements, you'll see a lot. Pet-tinic, usually used for anemia. It's vitamins. Nutrical is a high-calorie goo we use all the time. It's my favorite thing in the world, and I will give it to everybody. Metamucil is like a fiber supplement. You don't want to do it too much, but it is good if they are just leaking poop everywhere. Miralax is a laxative. We've seen that one a little bit with Kenley to try and keep things moving. And Fortiflora is a probiotic, same as Benebac. Fortiflora actually has a taste to it. So if you notice they're really not eating their food with the Fortiflora in it, let us know because we can switch to a different probiotic, but Fortiflora is pretty good if they will eat it. So this is a lot. You don't have to memorize any of this, but I just want to give everyone an idea because we hear these words and we hear these medicines all the time, but to kind of give you an idea of what they're actually used for and the purpose behind them. So now we have routes of application and you get to watch my beautiful videos in a second. This is just, we have a lot of oral medications, examples, amoxidrop, azithromycin, Clavomox, Doxy, Drontal, Lactulose, Metronidazole, Panicure, Benaziril, Pyrantel, Pet-tinic, the list goes on and on for oral medications. Eye medications, there's also a little section in our medicine cabinet for eye medications. Afloxacin is usually used for ulcers on the eye. We don't use that one as much. Usually we try tobramycin or terramycin first, but you will see us use afloxacin also. But Tobra, Terramycin, you guys are all very familiar with. One's the drop and one's the creamy ointment. Sub-Q, so that's subcutaneously, which is an injection. We don't do intramuscular at the nursery, so every injection we would ever ask you to do, if you're comfortable doing it, would be a sub-Q injection, which most of you have already learned. It's where you tent the skin and then stick the needle into the subcutaneous layer. Oh, I can't talk. Subcutaneous layer. And if another one, so like the difference would be like intramuscular is you stick it into their muscle, which is actually really painful. So if you accidentally were to ever stick it into their muscle, you would definitely know. But subcutaneous, we do a lot of ampicillin, B12, Baytril, Serenia, we do all the time. Lactated ringer solution is the fluids, LRS, and then Pen-G. Some of these, I won't go into too much detail, but some of these are thicker. You have to use bigger needles, but yeah. And a lot of the ampicillin and Baytril are pan-Luke medications. Luckily, we don't have to use any of those right now, but in the future, there will come a time again when we have pan-Luke and we will be using those medications. We have a lot of topical or transdermal medications also. We kind of just put these all into the same category, even though they're kind of different. Dermavet, we use on kind of wounds. Mertazapine is an appetite stimulant. We don't use it too much, but we have had to use it in certain situations. Whale in the Revolution goes on the skin for fleas. The SSD butt cream, we've been using that one a lot on all our little butt babies. And then Tresiderm kind of fits in here, kind of not, but it's the eardrop that goes in the ears. All right, oral medications, here we go. All right, so now we're gonna talk about how to draw out medication and also give oral medication. So this litter is each getting 0.3 of panazerol. Instead of filling up 5 of these with 0.3 of panazerol, I'll fill it up for multiple kittens. So I'll put 0.9 in here. So that means 3 kittens are going in this one syringe. And I'm gonna put 0.6 in here. So 2 kittens are in this syringe. You don't have to do it that way. I find it saves myself time, so I don't have to open up 5 of these and pull it out multiple different times. Instead, I just open up 1 and fill it. But if you're not comfortable pushing a set amount into the mouth, it's fine to open up multiple. So you open up your syringe, shake up your medication if it needs to be. This is the panazerol. You'll stick it into the top. You'll flip it over. He specifically is getting 0.3. So sometimes you have to pull it out and there'll be an air bubble and you have to press it back in so you don't get that air bubble anymore. So 0.3 is for him. Another 0.3 is for his sister. Another 0.3 is for his other sister. So I have 3 kittens in here and I'm only gonna push 0.3 into his mouth specifically. The reason I can do this is because they're all in the same litter. If they were a different litter, I do not want to use this syringe again. This syringe is garbage after it has been through this litter. So now I have 2 kittens left I'm gonna need to do. So I'll get my, another syringe. That had a cap on, so that's fine. So I get my other syringe, put it in there. There's an air bubble, so I need to press it back in. 0.3 for the brother, 0.3 for the other one. So in these 2 syringes, I now have 5 kittens worth of medication. Like I said, you could get 5 syringes, each with 0.3, but this was much quicker than opening up all those syringes. I can only use these for this litter because they're all related, they're all using the same litter box, they're grooming each other, they already are sharing each other's germs. Say I forgot to put in the extra kitten in this, and I give him this medication, and I'm like, oh my gosh, I have 1 more kitten left, I forgot. I cannot put this back in here. This has been in his mouth, this has germs, it cannot touch this because now I've contaminated this whole bottle of panazerol. So, if you realize, oh my gosh, I only put 2 kittens in here and I needed 3, go get a new syringe. Do not put this used syringe in here. This bottle should always be considered clean. I'm using clean hands, no gloves, no dirty kittens. This is clean. This is still both clean for now. And yeah, so now I'm gonna give him his medication. I put on my gloves. He's loving his little box. Hey, very cute. All right, so as you can see, there's 0.6 in here, but he does not need 0.6. He needs 0.3. So I'm only gonna push half of this into his mouth. I always scruff when I'm giving oral medication because it gives me better control of their head and it's over quicker. I just think it's much, much easier. So you'll scruff, side of the mouth. Doesn't help if you can't see the numbers, so I need to see the numbers. Push to the 3. And that's it. And he's done. So now I'll go and show you me doing his siblings. So he's done. I need to set him to the side so I don't actually give him any more. So I'm gonna do the orange ones first. All right, so we have sibling. I only have 0.3 left in here, so he gets this whole thing. Ah, yum. Now, I have 0.9 in here, but they're only getting 0.3, so we're gonna go down to the 0.6. Yum. Your turn. Down to the 0.3. Wow, he doesn't like it. And her turn last. She gets the rest of my little syringe. Yum. And that's it. And that's how you do oral medication. Okay, so I want to get this to go away, but next, all right, so pilling, our favorite thing to do. So I have a nice video on pilling. All right, so the next thing is pilling. Have you been to the critical care class? You have obviously seen this already. I am not the best at pilling. I will be the first to admit it. How I usually pill, so I have my Drontal pre-cut already. It's hard for me to pill with gloves that are too big for me also, so I'm gonna try and make them tighter. It's really large. So you have your pill. What I like to do is I like to scruff them and turn them upside down. Pull open their mouth, drop it down the center. Oops, sorry, that wasn't the center. And hold close. And I rub their throat and blow in their nose. And really you just have to hold this lower jaw closed until they swallow, because that's the only thing that really opens. You don't have to be like, bah! You can just do like this and rub. And then I'll open, see if he swallowed. But he did, yay! And he was pretty easy. Other things you can do, you can try and put it in a churu. You can, some people you don't have to flip them upside down. You could just go like this and shove it and close. He probably would have accepted that, but some of the crazier ones, I definitely noticed it's been easier to pull them upside down and drop down the center. Like that. And he's such a good boy. So that's it. Sometimes you have to do it a million times. It'll turn to mush, then you need to get a new pill. If you're really struggling that much, go to Triwormer, which is the liquid for the Drontal substitute. But Drontal's always better if we can do it. Make sure they get it all and not foam it all up. So, yeah. So pilling, he was very easy. Usually I'm much worse at it. I don't like scruff them and hold them in the air. I was trying to teach someone and they kept scruffing and like holding them up in the air. As you can see, like I have him laying down. I'm only scruffing just so I can control his head and get the pill down the center. And then I get rid of the scruff and kind of rub his neck. But don't just like hold them straight up in the air and try and shove a pill down their throat. You can also try and put it in a churu. Littler kittens are kind of harder to do that with, but sometimes you can try. I never recommend crushing it up and putting it in food. Rarely works. They can usually smell it and then you've just wasted a pill. But I have pretty good luck doing it this way and just kind of holding their mouth shut. Something I didn't mention in the video is if you catch them licking their nose, that generally means they've swallowed. And it does take practice and sometimes it takes a million tries, but you can do it. All right. Alrighty, eye drops. This one's pretty easy. So eye drops, usually you'll have a full bottle attached to their kennel in a little baggie. This is contaminated because it's almost impossible to touch the bottle, touch the baggie, touch the door. So it's always safe to assume that this baggie with the medicine in it hanging on the kennel is going to be contaminated. So always use gloves. We don't want to use this bottle for any other litters because obviously my glove has touched him, it's touched his bottle. On accident, it could have potentially touched an infected eye, which avoid doing, but it could have. So this will always be hanging on their kennel. Usually, if it's not, you can go get a bottle from the medicine cabinet and hang it up. We don't want to reuse this bottle for other litters. So the first step, this is Terramycin, the one we generally use. So to do eye drops, you will take the cap off, and then the way I normally do it, especially if I'm alone, is I scruff and hold it upside down. Then I use a finger to hold open the eye, do a drop, finger to hold open the eye, do a drop. Sometimes I'll do like this if I don't think it got in, and that's it. Boop. So that's eye medication. Sometimes we use the Terramycin, which is the ointment. If you have a whole bottle hanging on a kennel, you can put it directly in their eye, and it does go in their eye. Even though it's an ointment, it does go in the eye. The difference between the two, the big difference between the two is that the Terramycin is a solution, so it's a drop. So you can do that like 3 to 4 times a day. It doesn't last as long in the eye, whereas the Terramycin is an ointment. It's oil-based. It kind of coats the eye, and you usually only do it twice a day, and it lasts a lot longer in the actual eyeball. So that does go directly in the eye. If we're trying to save the bottle, you can put a little bit on your glove and then kind of put it in the eye, but always do that with clean gloves, because you don't want to have a contaminated, poopy, dirty glove and then go put that in a kitten's eye, obviously. Injections. Most of you actually know how to do injections now, which is great. You never have to do an injection if you are not comfortable. If you would like to learn or would like more practice, just let us know. We do vaccine clinics like once a week. You can always come do a vaccine clinic, get some experience poking. Yeah, but we are going to go over it because more and more we are getting, especially this year, we have gotten so many medical cases that if you can and want to know injections, it is really good to know, and it helps not only us out a lot, but also the kittens. All right, so injections. Don't try an injection if you have not done one before, but I think most of you have actually gone to a critical care class and gotten some hands-on practice. If you want more practice, just let us know. We can always have you help with vax clinics. We can always go over medications with you. He's so sick here. I use them for everything. So just let us know. We can always teach you how to do B12 or fluids or Serenia, whatever may be needed. Right now we do have, one of the kittens here who is getting Serenia every day. He's getting fluids every day. So it is helpful if people know, but if you don't want to, that's also okay. But it's not as bad as it seems. So last thing I'm going to do on this poor baby is B12. This is just a vitamin, kind of immune booster type thing. The first step, it depends if you're left or right-handed. So I'm right-handed. So I'll have him face this way. With my non-dominant hand, so my left hand, I'll make a tent in his back. So you don't want to do his neck. We say a scruff, but you don't want to inject him on his neck. You want to go a little bit down, and you make a tent. And it's a tent because it's like a triangle. You'll feel there's going to be a little pouch. So in the middle of the tent, you feel there's a pouch, and that's where your needle's going to go. So you have your needle with your medication already all done up. Bevel, which is the little hole, goes up, and that's just because it goes in easier. You make your tent where you're going to inject. You feel your little pouch. You put your needle in, and you will feel a pop. If you are not sure if you're in, you're not in. You'll know. You inject the medication, and then you pull out, and that's it. And I always give them a little bit of love. So you will feel the pop, so you will know the needle's in, and then you'll inject the medication. What you can also do is you can pull back on the plunger. So while you have the needle in, pull back on the plunger. If a ton of air comes in, that means you've poked all the way through the skin and you're not in the subcutaneous layer anymore. If you pull back and there's resistance, that means you're in. So that was it for injections. They're actually super easy once you get the hang of them, and they definitely help out our little guys. So if you want to learn, just let me know. Yay. So yeah, we do use injections a lot more recently. It is useful if you want to learn, just let me know. I had something else to say and I don't remember about it, but hopefully I'll remember later. Subcutaneous fluids. We actually use this one a lot recently. And we get a lot of questions of, okay, I know how to poke the cat with the needle, but now how do I get the fluids out into the syringe? So I actually show from start to finish in this video. This is on YouTube. If you're ever like, oh gosh, I can't remember, how do I get the fluids into the syringe? Like, what was she talking about with 2 different needles? You can always go look it up on YouTube or in the drive, and it's there also. So now we'll talk about fluids, which we need more and more at the nursery. It's a really good skill to have. It helps bring down a fever, dehydration, helps with a bunch of stuff. It's similar to injections, which we just talked about. First, we'll talk about the things you need. So the first things you need are syringes. So depending on how many milliliters of fluids they need will depend on the syringe you take. This guy is small. He's only going to get 10 milliliters. It's 10 milliliters per pound. He could actually probably get more, but he doesn't technically need them, so I'm not going to give him a lot. So we have a 10 milliliter syringe you could do. We also have a 20 milliliter syringe you could do. And then we have the big 50 milliliter syringe, 60 milliliter syringe that you can do. So if they need a ton of fluids, bigger syringe is always better. If they don't need a lot, you can go smaller. But I'm just going to use the 10 for him because he doesn't need a lot. So the thing most people struggle with is how do you get these fluids into here? So the first thing is you need a needle. I like a bigger gauge needle because it goes into the syringe faster. So this is the 19 gauge that you find on the intake table. So you'll open up, I can't do it with gloves on. Sorry, buddy. You'll open up your 19 gauge needle. You'll open up your syringe. He wants to get weighed. So you'll put your 19 gauge needle onto your syringe. This is not a lure lock, so there's not going to be the little like twisty part on here. It's just a syringe. So you'll put it on there. It still twists a little bit to get on, and then you'll take it off. You'll have your big old needle. Now you have your fluids. You'll put your needle into the little squishy part into the bag of fluids, and then you'll pull out. If you had a smaller needle, it would take a lot longer, and you would have to use a lot of pressure. So I now have my fluids. And that was easy. All right, so you get all the air bubbles out. So you press until there's no air left in that syringe. And now you don't need this needle anymore. This needle was just to get the fluids out. You don't need it. In theory, you could inject a kitten with a needle this size, but you won't want to because it's not as nice. So let me put my glove, actually no. So now you have your butterfly needle. This is the easiest way to give a small amount of fluids. If you have to give a ton of fluids, it's easier to use a bigger needle, but this is a 25 gauge, so it's really small. It's nice for tiny little kittens and when you only need to give a small amount, but if you had to give like 100 milliliters, you should probably use a bigger needle because it's gonna take you like 10 minutes to push that. So you open up your butterfly needle. This is your butterfly needle. And you just take off the top and put the top onto your syringe. Again, it's not a lure lock, so it's not gonna like super lock in there, but you just put it on, press to get all the air out of that tunnel, and boop, we're ready. So let me put my gloves back on. He is. He's ready to be weighed. He sat here on his own. All right, so now we're ready. So this is the same as normal injections. So you take your lid off, cap off, and then you have your needle. Bevel goes up. So you make your tent with your non-dominant hand, feel your pouch, put the needle in. So you don't actually have to hold this needle because it's a butterfly needle, it'll stay in there. What I do instead is I actually scruff the kitten so he can't run away from me. And then I press, and they don't like it. But this is why I scruff. And I go as fast as I possibly can to get it over with as fast as possible. If you go slower, it doesn't help. So I just go fast. And boop, you're done. How do you feel about that? You will see a little fluid bubble, especially depending on how much fluids you gave. That's normal, that'll dissolve in about 4 hours. Normally, it'll dissolve quicker if they were actually dehydrated. So that was it, and he got his fluids, and he's ready to go. Whee! Oh, what I was gonna say is, A lot of people feel guilty poking little kittens with needles, but if you think about it, they have tiny little needles on their little claws and their teeth, and they wrestle and they bite each other and they scratch each other. And it's really not that big of a deal to poke them with the needle because it's kind of the same thing. All right, so that's fluids. So now, one thing I didn't show in this video is if you wanted to, now that we have bigger syringes, it's nicer. But if you wanted to do 30 milliliters in 310 syringes, you could do that. You would fill up 3 10s, inject the one, then you would just take off the cap, put the next syringe on, inject the second one, take off the cap and put the next one on and inject the third one. The needle can technically stay in the kitten. Sometimes it's hard because like if they're like running away from you and running around, like it's not going to stay in. But if you have like a second person who's just holding them, you don't even have to take the needle out and repoke them 3 times. You can just attach the syringe to the needle that's already in. But now that we have bigger syringes, you can also just fill up, you know, the 20 milliliter syringe, and that's easier. Taking temperature. We have 2 ways to take temperature, which I'll go over here. Go. All right, so now we are going to take temperature. Temperature is super important because you need to know if they have a fever or not. Sometimes you can feel them and think they feel too hot and then they don't actually have a temperature. One thing I just remembered, I did not warm the fluids. Little tiny babies, you do want to warm the fluids. Sometimes, I will be honest, if they have a fever, you do not want to warm the fluids because the whole point is to bring down their temperature. But a lot of times if they're older, I just give them room temperature fluids. That's why he was screaming, is because it's cold going in. It's not cold going in, but it's not, you know, 100 degrees, which is their body temperature. So that's why he was screaming when I gave the fluids, because he was uncomfortable. So you can warm him up if you're not giving them for a fever and you're giving them to like a smaller kitten, definitely. But a lot of times I do not for older kittens, and especially ones that need it because they have a virus that has a fever. Okay, sorry, I just wanted to say that before I forgot. So if they're not feeling good, it's always good to just get that temperature and see if you need to do any type of supportive care. So we have 2 different ways to get the temperature. We have the ear and then we have the butt. Ear isn't as accurate as the butt, but it's also less invasive. This is the ear thermometer we have at the nursery, and you open it like this. And then there's the little probe covers. They're in this little black thing, and then the probe covers are blue and it matches this. So you just pull it down, oops, and then you stick one in until it snaps. So now there's a probe cover on here. And to get the temperature in the ear, first turn it on, wait for it to turn on, and then you'll pull open the ear and stick it down the ear canal, and you'll press the button. And it'll do a beep. I like to take it a couple of times to make sure that I'm getting an accurate reading. I'll even sometimes do both ears, and I always take the highest. So 98.3, that seems low. I don't think that one's right. So I'm gonna go to the other ear and take that. Okay, so it does say 98.3. So I guess we will test that and say 98.3 for the ear thermometer. You're very cute, yes. And then we'll also now do the butt. So for the butt, you'll need 2 things. You'll need your petroleum jelly or surgical lubricant or Aquaphor, whatever you have, and then your thermometer. So you'll take your thermometer out. You'll put just a little bit of lubricant on it, so because it has to go up the butt. Don't need a lot. And then it's easier if you have 2 people. If you only have 1 person, you can kind of like lean over, hold the tail, put them in your nook and go for it, but it's much easier if you have 2 people. So you start it and you put it in the butt. It'll say low if you're outside of the butt because it's like too low of temperature in here. It's like 70 degrees, so it's not reading that. But once you have it in the butt, you go just so the metal tip is in. It's about 1 inch, maybe not even quite 2 inches. And you just wait, and it's going up and up, and it does take a while, so it's normal for it to take a while. And he's actually being a really good boy, so I am just holding him in between my arm and body. Supposed to beep when it's done, but this has stayed the same for a while, so I'm going to assume it's correct. This one might be low battery, but 102.8. So that's much different than your ear. I should probably get further down in the ear, which I'm actually going to do right now to see if I can get a closer reading. So 102.8 is actually a little high. It makes sense because they have goopy eyes and the start of a upper respiratory infection. Okay, so the further down in the ear you go, the better, because now I got 100, which is closer. This is just a very little ear. Come on. Okay, so I'm gonna guess his temperature is probably closer to the rectal one, which is 102. Hi. 102.8. So in that case, usually you'll do fluids to bring down their temperature and stuff like that. But if you ever take a temperature and it's over 102.5, let someone from the nursery know so that we can tell you what to do. Yay. So yeah, normal temperature is usually about 99.5 to 102.5. If it's higher, lots of times we'll just do fluids to bring it down. If it's like 106, that's emergency level. So definitely spring into action if you ever take a temperature and it's like 106. As we saw here, the rectal temperature is more accurate. You can use the ear thermometer to get like a general idea. It's easier if they have bigger ears. We use it at the vet hospital I work at a lot, and it's pretty accurate. It's like the same on dogs, but dogs have much bigger ears, so you really kind of get it in there. He's a tiny kitten, so it's a little harder to get that in there. So they actually, at the vet hospital I work at, on anything under 4 weeks, you have to do a rectal temperature, which is really sad because that's really big for their butt, but it is because it's more accurate since their ears are so tiny. Sometimes, so the vets say you cannot feel a cat that has a temperature, but if you are used to petting that cat and knowing what they normally feel like, I believe you can tell when they feel a little hotter than normal. And so that's when I would always take a temperature. Or if they just seem sick or lethargic or, not eating, whatever it may be. But to do the rectal temperature is always a better idea. I didn't really need Vita in the video because he was actually being very calm with like holding him against my body. But in theory, you'd have two people. A lot of kittens don't take it that nicely. And so you'd have one just scruffing so that can't run away. All right. This is actually close to the last thing. So I'm doing pretty good on time here. So these are medication shelf to love tutorials. This first one, I really, really hope everyone already knows how to do, but just in case maybe you do it differently, here we go. So this is finding the tasks and checking them off. And there's no sound for these because I don't know why, but so I could talk over it. So you press the little check mark, you go to locations, go to nursery. Otherwise you're gonna get every single cat in the rescue that's on meds. Here, it'll show our cats, but you want to filter either by morning to show the morning meds, or you want to filter by evening. And then there's the evening meds. And then to check it off, you select, it'll select all of them though, if you press the select button, and then you can complete them, make sure it's you there, and save it. You can also check off individual ones, especially if you want to leave notes. So like, say I didn't give this cat his medication for some reason, I could check it off and then put notes specifically for him. But if I checked off every single animal on that list and then I put a note in, it's going to show up for every single animal on that list for every single medication. So hopefully everyone knows how to do that. That's how we see what needs to get done for medications at the nursery. If you ever see a medication on a kennel, or if you ever see one, or like you thought we started something on Sling and you couldn't remember, but it's not in Shelter Love, always ask. I'm trying to be pretty anal about getting medications into Shelter Love, just because, you know, it's good to record every single time they've gotten it. It's good to just, you know, have records. So if you ever notice something's not in Shelter Love, please, please, please let me know and I will get it in as soon as possible. It'll also help me if you have like the dosages and stuff. So like say Dave went to primary care animal hospital, came back with a bag of medication, you can just send me a picture so I know the concentration and the amount he's getting. I'll also be showing you in a second how you can actually do this yourself, but always just double check to make sure that you should. All right, medical memos. We do not use this enough. Oh, Abigail. So we do not use this enough. We should use it more because it's really good. Sometimes, as you all know, it stinks scrolling through 1,000 shift updates to figure out, oh, how long did they have diarrhea for? Or when did we say that lymph started? Or, oh, what was that again? So if you can, do an internal medical memo of what you witnessed, what you experienced, what your volunteer told you, whatever it may be, so that we actually can track it. So say you write this on the August 1st, and now all of a sudden it's like August 21st and they're still having the same problem. I mean, hopefully it wouldn't go that long, but we can track it, be like, oh my gosh, they've been having this problem for 3 weeks, like this is serious, or whatever it may be. But it just gives us a better idea of how long things have been going on, the full medical history of the cats, and not have to scroll through and read every single shift update from like a month ago. So I'll show you how to do a medical memo. So go to the cat, click memos, bunch of different memo types. We use them for a bunch of different things on the nurse rescue, internal medical. This will not show up on their medical history that gets sent to their adopter. That's why it's internal medical. If you do regular medical, your little note is going to show up on the medical history for the adopter, and then they're going to freak out and be like, oh my God, why did they have yellow diarrhea on August 1st? And you're like, oh, we fixed it, you know, nothing to worry about. But that's how you do it. Memos, internal medical, type it up, post. It's super easy, super fast. If possible, you could do it. Okay, recording medication. So for example, Alexa just had to deal with this, I don't know, 2 nights ago, 2 nights ago, because she was like, hey, there's sneezing, there's goopy eyes, there's all this stuff. And I asked her to give medication. If in theory, it would be great if you could do this yourself. Sometimes I'm on a plane and I don't have access to Shelter Love when I'm on a plane, and then it's 5 hours later and I completely forgot. So if you can, if someone tells you to give a medication, me, Jessica, or Claudia, if you can record the medication you gave in Shelter Love, that would be great. And this is how to do it. So you're in your cat, you go to medical, go to treatment, and you do complete treatment because you've already given this medication. So it was today, right now. Sometimes there's quick fill templates, but otherwise you can just type in whatever you gave. So here I did Pyrantel. I gave it by mouth. No multiple doses. How much I gave. And then that's it. You can also do multiple doses, yes. And be like I said, oh, I would never say this because I wouldn't ever say this about Pyrantel, so I'll say Panazerol. It would be Panazerol for 3 days. So you'd complete it because you gave it tonight, and you would put in 0.3 Panazerol, yes, multiple doses, and then you'd type in 3 days, the duration. And that's how you would do that. Scheduling medication is a little different. So scheduling medication means you're setting up medication. You won't run into this one as much. Normally I do this, but if you ever have to schedule a medication, obviously make sure someone told you to schedule the medication. But this is how you would do it. So same thing, medical treatment, and then you schedule a treatment instead of complete it. So tomorrow we need to give Revolution. Oh, here, this is a good example. So tomorrow we need to give Revolution tomorrow we need to give a bath because I just gave Revolution today, but they're covered in fleas. So you have to schedule it for like over 48 hours out or whatever. So like in theory, you could do this because oops, I gave them Revolution. We can't bathe them now. So you want someone to do it in 2 days from now. So you'd schedule it, type the day you want it to be done. Time, always put morning or night so it shows up. when you go into the task list, if you just leave it at like some random time, like 3:44 p.m., it's not going to show up. So Clavomox, by mouth, how much, how often, which Clavomox is always twice a day. And then this is the duration, so 10 days. So you would type that in. And that's it. And then you could write notes. Someone would have told you to do this, so that's why I write this here. But yeah. And then you would save it. And that's it. And so now it will show, oh, tomorrow we need to give 0.2 Clavomox, and then we'll start that for 10 days. Ooh, did that just go? Okay. So a few random things. If a medication, I already talked about this a little bit. If a medication is on a kennel, but it's not in Shelter Love, please let me know so that I can add it in Shelter Love. But it doesn't help me if I don't see the dosage. So if you can send me the label of it, that would be great. But ideally, I'd want to get that in Shelter Love as soon as possible so that we can track it effectively. If a medication is not labeled, so if someone mixes Clavomox and puts it in the refrigerator and they don't tell you, they don't write down when it was mixed, in theory, you don't know how long that's good for. So we would like, if you mixed it, put the date you mixed it on. If it's, I usually am the only one who will deal with this, but if I need to refill a bottle of something from the med cabinet, I should put an expiration date on there that's on the bottle, because otherwise we don't know when it expires. Clavomox actually, they say is only good for 2 weeks in the refrigerator. You can push it a little bit longer, but I just threw away a bottle of Clavomox in the refrigerator that was mixed on June 9th. So that's like way overdue. That was mixed so long ago. So if a medication is not labeled, one, try and figure out when it was mixed or when it was put in. But in theory, it might not be good anymore. Also remember to check off tasks in Shelter Love. It's very important to check off the tasks in Shelter Love so we know that the medication was given. Some medications are super important, like, and you can't miss a dose, otherwise it messes up the whole antibiotic course. So please remember to check off in Shelter Love. I talked about that a little bit too. If you try to do it by the cat or litter, if you're adding notes. If you're not adding notes, you gave everyone everything, everything's great. You can just check everything off at the same time. And then I talked about tracking ongoing issues in medical memos. Ideally, it would be great if we could start doing that. Okay, I'm gonna talk for a couple more seconds and then I'll open it up for everyone to talk. Frequently asked questions. We get these questions all the time on Sling. What is Drontal called? Drontal is worm out. I actually wrote Drontal on the lid. It's also going to be hanging up on the medication cheat sheet, but Drontal is just another name for worm out, which is technically pyrantel and praziquantel pill that kills worms. Panacur is the brand name for fenbendazole, is the active ingredient for Giardia. Panacur, the one we get, is called Safeguard. It has a goat on it. That will also be hanging up on the above the intake table. How many milliliters per pound of LRS? 10 milliliters per pound. Occasionally, Dr. Tran will give you different directions. So like Kenley, he's getting 35, but he only weighs like 2-something pounds. But that was prescribed by our veterinarian. But the general rule, 10 milliliters per pound of fluids. We did have some issues with differing dosages on the med chart by the intake table versus what was in Shelter Love. I should have just fixed all of that. And it was due to differing concentrations. So that should all be fixed now. I need to print it out. I probably won't have time till I get back. So it might be a week from now, but I will post the new medication cheat sheet and the new medication chart on the wall as soon as I can. It is in the Google Drive. The updated one is in the Google Drive if you want to see it. The med cabinet key, if it's not in the door, in the lock, it should be in the black little container thing underneath the computer. So like a little metal drawer. That's where it should be. That's where it belongs. Revolution is usually in that blue bottle. We got a new Revolution recently. Now that Revolution's, I think, like patented or whatever went up, now there's Revolt. So it's the same exact thing. Revolt Revolution, and it's in the blue container. The dose, I updated it to the medication cheat sheet, but it's also in Shelter Love, like underneath where Revolution's scheduled. I wrote it in there for that and Drontal. And I think that is it. So let me look at the chat first. Okay. Used to be a heating pad near the intake table. I think it's broken. So I think we possibly got rid of that heating pad. We did have I did have a crash cart. I did, but turned out that heating pad was broken. So we do need to get we should have a designated heating pad in a drawer, and then Caro and blankets. Yes, Starla was playing. It was very cute. Oh, make sure they don't hide it in the lip, spit it out for pilling. Yes, that's why I actually always open up their mouth to make sure they swallowed it. Sometimes you'll be like, oh, I'm sure they swallowed it. And then you let go and then they spit it out and then you have to start all over. But if you look and you see it's still in there, then you can just keep holding their mouth closed. Papaya, it was papaya. And then it was also turmeric. They were both orange. I can't remember, but I did half and half. Oh yeah. So for fluids, yes, I actually did that before I even put my gloves on. So you push it so all the air gets out of the tube. One thing you may notice, so if you accidentally get air in the skin, it's not going to hurt them, but later on it might feel crinkly. And it's because there's an air pocket there now from the air you got. So sometimes you'll feel and their skin will feel crinkly. It doesn't hurt them. It's okay, but it just means you got air in it. D, mixing Clavomox. It is actually on the back of the box. I don't think it's on the bottle, but it's on the box. So on the box, it says add 14 milliliters of water and shake. So that's all you should have to do. Oh, thank you, Liz. Syringes for injections, usually 1 milliliter, so that you can get an accurate, we deal with little Kittens, so we usually deal in small amounts. So a 1 milliliter would be good. You can use an insulin. The problem with an insulin syringe is that it is not in milliliters. It's in units. So I actually recommend don't use that unless you know how to convert it. So usually 1, because we're dealing in such small amounts like 0.07, you cannot get 0.07 in a 3 milliliter syringe. If you had to inject a milliliter of something, then yeah, you would want to use probably a 3. But it just has to do with the amount. Oh, thank you, Susan. And which needle is used for injections? Depends. B12 Serenia, you can use 25 gauge because it's not very thick. So that's a small needle. If you're doing Pen G, you cannot use a 25 gauge needle because it's not going to come out. It's too thick. So you need to use a bigger needle. I usually use, I'm kind of mean though. So I guess I use a 20, which you don't have to. You can use probably 22, but I use a 20 to get it over with. For FIP medication, where knock on wood, will not have to deal with this ever at the nursery. But FIP medication is super painful. So I actually use a 19 gauge needle on that, which is a big needle, but it's so that I can press it in super, super fast and get it over with, and then not have them sit there with painful medication going in their bodies for how long it takes me to push. Okay, you guys can unmute yourselves if you want, if anyone has any questions or comments or anything. Shannon, for Kenley, he has a specialist appointment next Wednesday. If it is a stricture, prognosis is 50-50, which is not ideal, but the radiologist thinks it probably isn't a stricture, so we have differing opinions now. So we're just gonna wait till a specialist appointment. Anyone else? You can chat or you can talk. I know it's a lot of information. I'll send this PowerPoint out so everyone has it. And always ask questions. There is no stupid question. better safe than sorry. Say you had a brain fart. I mean, I asked like the dumbest question the other day. I like had a brain fart and couldn't remember like, it was something like I do all the time. I like couldn't remember the pyrantel dose. I was like, how in the world do I not how to do this math? It's 0.1. But sometimes you just forget things. So no worries. Always ask questions. Better safe than sorry. If you're not comfortable doing an injection or fluids, you don't have to do it. That's perfectly fine. Just let us know. So like if it is essential, like say pan-loop meds, someone has to come in and do it. So if you aren't comfortable doing something, just make sure you notify someone. Yes, injection, if you pull back on the plunger to make that, oh, that's true. I said so you don't get air to make sure you didn't poke through, but also blood. I've done that on a vaccine once. I pulled back and I got so much blood and it was crazy and it looked pretty cool. And I was like, wow, how can I hit the vein giving an injection? But I could not get this kitten's vein earlier. So yeah, if you get a bunch of blood, that means you're in a vein, not in the subcutaneous layer. So when you pull back, it's not the end of the world. If that happens, it's fine. But sometimes you will notice, like if you give an injection, and you notice on white cats a lot, like if you microchip a white cat, there's usually a lot of blood, but I think that's because they're white. Recommendations for when we run out of recommended foods depends on the food. So if it's just like they're picky, so like they only want to eat Shiba, you can just try new foods or try Nulo, see if maybe they've changed their mind and now they like Nulo. Always just, if it's because they're picky, just try something else. If it's because it's prescription, let us know. Nulo is a healthy food. Stella and Chewy's is raw. So that's also like Nulo and Stella and Chewy's are good if we run out of our prescription foods, generally like Kitten GI and stuff. But ideally we wouldn't run out. So if we're running low, if someone notices we're running low on prescription food that is needed, please let us know as soon as possible because shipping takes like, for Royal Canin, they were back ordered. It was taking like 2 to 3 weeks. So let us know if you notice we're running low on our prescription food. A lot of the other foods are usually donations. So like the Royal Canin Kitten and the Tiki Cat Mousse, a lot of those are donations that we use for the nursery kittens. So we can buy it if we absolutely need to, but generally we kind of just use what's donated. Anything else? All right, if nobody has anything else, that will be it, I think, unless someone is thinking of something I missed or didn't explain properly. All right, well, thank you so much. I'm sorry it was a little over an hour, but yeah. Hopefully this makes everyone a little more comfortable with medications.